Hello, I'm Dr. Erin Denil with Rejuvenate Life Chiropractic, and today I'm going to talk about how long it takes to correct nervous system disturbances. It's a question that I get asked a lot about, what all does healing encompass? And in order to really correct nervous system disturbances, we need to address that at multiple levels. So it's going to depend on a lot of things that are patient, dependent. One, how long has that nervous system been disturbed? If something, how many major accidents did a person have? How much emotional stress? Okay. What phase of degeneration the body is in? We don't know how much damage has been done to the joints. Hence, we will be, on most people, taking an x-ray to find out what do we have going on here in order to have a better recommendation for how long it's going to take and if it's possible to correct or if we just maintain what we have. How well the sympathetic or parasympathetic nervous system is working. Those are big words. Think fight or flight, like adrenaline kicking in, or rest and digest, like you're trying to digest your food. How well the autonomic nerves and motor nerves are working. So we have different tests that can measure those things. The degree of weight or uneven weight distribution from side to side, like with bilateral weight scale. This one is going to be another big one, taking personal responsibility for eliminating physical, chemical, or emotional stressors. Okay. When people want to know how long it's going to take, it's really dependent on how much work they want to put into it. Health is the patient's job. The patient heals. Okay, my job is to remove nervous system disturbances, and the patient's job is to do the healing. Their body has to do that healing. I can't do it for them, and nobody else can. I can't eliminate other causes of their physical, chemical, or emotional stresses in their life. They have to do those things. I can educate, yay! I can do talks like this. I can tell people some of the healthy, tips that they need to do, but I can't make anybody do it. And neither can you for your spouse or any other person that we've tried to control, right? It's hard enough to control ourselves, much less control somebody else, right? A strict adherence to the recommendations for care as well as the congruency of care is absolutely necessary. You can't put braces on someone and then take them off and put them on and take them off and expect corrections to be made. It's a similar process in the fact that our body is going to need to take time in order to reprogram that information in the brain. We're taking the system that it remembers and we need to change it. We need to alter it. So if you think about a process for memorizing, it takes a little bit to get those pathways firing in the brain to recall the information. You might be like me, I get stuck. I'm like, where is that file in my brain? It's at the tip of my tongue. I know it's in there. How do I retrieve it? The more times we use that information, the more neural pathways are actually created. So the more things that we can connect, the easier it is. The same is true for reprogramming our nervous system for all those disturbances as well. We need to keep it on, a consistent, regular basis in order to really make those changes. We also need to have certain things to support our healing, okay? For healing and then for staying well. Like, for example, 20 minutes of walking every day, 20 minutes of prayer or meditation, 20 minutes of healthy meal prep, getting enough water, getting enough sleep, wellness chiropractic care. It only takes 7 to 10 days for more scar tissue to lay down, which can cause that whole disturbance to the nervous system again. So checking people regularly, getting your chiropractic care is important. A lot of people are nutrient deficient, so there's supplements, and I have more information on my products tab on the website for Optimal Health Systems are the supplements that I use, whole food supplements that are going to have a good amount of things available in it. Multivitamin and mineral, probiotic and essential plant-based fatty acid, digestive enzyme, vitamin K, vitamin D. Okay, all of those things are necessary for most people to support because our food just doesn't have it. Okay, so those types of things are fantastic. A CBD oil as well as nitric oxide are another 2 recommendations that I have in the nutrient category for most people that they're going to benefit greatly from taking those. So concept, in order to correct nervous system disturbances, it takes a lot, right? It's going to take some time because it took us some time to get into the state that we're at, depending on where we came in to the process in our disease cycle, okay? But concepts that I'm going for to educate on is a health for life, like fit for life, and nutrition for life, and nervous system health for life, and spiritual health for life. A lot of people neglect that one, and that one is actually one of a very good predictor of longevity, along with our social interactions. So those two things are really important. Our interactions with people and how well we feel in a community, our spiritual or religious community, is important. So how long does it take? It's going to depend situation to situation on all of these different types of things. We didn't just wake up. Most of us think we just woke up, I reached down, I threw my back out. It's not just a muscle pull, okay? Most of the times with a muscle pull, if you see people in the NFL and they pull a muscle, right, they're not walking, okay? A lot of times it won't be that muscle pull. It will be other underlying nervous system disturbances, okay? And the process is relentless and it's progressive and it gets worse over time, and it's a disservice if I were to not recommend the appropriate amount of care. So there's lots of information that needs to be gathered based on that individual patient, but it does take time. I'm a straight shooter. It takes time. Healing takes time, okay? But the cool thing is when our body functions as optimally as possible for it, based on different things. Example, I don't have a gallbladder or an appendix prior to chiropractic. I'm not going to function at 100%, maybe as close to somebody else who does, because I'm missing organs. Can't make up for that loss of function, okay? I try with different supplements and things, but my body has already, taken a notch down of what is possible, but with whatever I have, I'm going 100%, okay? Because I'm skydiving at 100. So we all have lots of fun things that we can do. So how long does it take? It depends. Sorry, long answer, and not the one people wanted to hear, but it's the truth. Again, I'm Dr. Erin Denil with Rejuvenate Life Chiropractic, and I hope you have a fabulous day.